Hello, everyone, and welcome to the Breaking Barriers to Independence interview sessions again. My name is Danielle McGill, Disability Consultant for Empowered Possibilities. I'm here today with Olivia Babis. She is a Public Policy Analyst for Disability Rights Florida. And I so appreciate you taking the time to talk to us today about the ADA and disability-related issues and about your background and what you do in your community.
All right, thanks for hosting all of this and inviting me to participate. I appreciate it.
Absolutely. The whole point is to shine light on what other advocates are doing across the state of Florida. So tell us a little bit about your background, your childhood, and your experiences.
Right. I am one of those rare native Floridian people that actually was born in Florida and grew up here. There's not too many of us. Most people are transplants. But I grew up before the ADA passed, or actually it passed while I was growing up. So I am able to compare and contrast the difference in life from that. And
can you tell us a little bit about that?
Sure. I often tell people I feel like the living embodiment of the disability rights movement sometimes, just seeing the changes that have happened from when I was born to where we are now. So when I was born and when I started school was around the time that the 504 regulations were implemented, IDEA was starting to be implemented. There was, of course, the Geraldo Rivera expose on Willowbrook.
Were you separated from the from your able-bodied peers?
Yes.
Okay.
My grandparents, I lived with them most of my childhood, and they were told actually to put me in an institution after I was born. I wouldn't have more kids. That was up to her, but just kind of lock me away and forget about me. But
wow.
The Rivera expose came out, my grandparents were aware of what happened in institutions, how individuals with disabilities were treated. They weren't educated. They wanted me to have quality of life. They didn't see any reason I was born with a physical visible disability that I should have the same opportunities as everyone else. And there were a lot of battles around that, of course. Especially since a lot of these laws were just being implemented. Counties and states were trying to figure out, how to make this work. Of course, society in general wasn't in support necessarily of these measures.
Do you fear that our state and our country is going backwards in some ways?
Yeah, absolutely.
Okay.
One of my first memories is when I was about 3 years old. And I grew up in Polk County, and the school system there was trying to figure out how to integrate students with disabilities out of the center schools and into the public school system. And so we were at a school board meeting, and I was tiny. I was 3. My grandmother, carried me in on her hip, and we were shuffled into this room that was just jam-packed with people. And I was kind of tucking my head down into her shoulder and just peeking around the room at people over her shoulder. And people were yelling and screaming about how they didn't want those kids and their children because, we were going to dumb down classrooms and, we were contagious. I don't know.
So there was already a stigmatization
Absolutely
already set in play for you.
Right. And I remember just looking around the room, and people didn't want to make eye contact with me, or they would briefly and give me like this half-hearted smile and kind of look away, or, they just saw a little kid peeking up from my grandmother's shoulder thinking, oh, we were there on that side. And then they would look down and see, oh, I had a disability. And they would kind of dart their eyes away. And I just remember thinking, what did I do? I was 3 years old. What could I have possibly done?
Yeah. You're probably wondering, why are these people staring at me like this? But
why do they seem so angry at me? Like, what did I do? Why do they hate me so much? I haven't done anything to them. They don't know me, and I think
now we're teaching the next generations to say hello, to approach people with disabilities. So there is some change happening.
But I think really that was kind of my motivation into advocacy, is just very vividly remembering being in that situation. And for me, you know, nobody wants to experience anything like that, but I think that has turned me into the advocate and the person that I am. But it doesn't mean that I want other people to have to experience that as well. And so, you know, we had battles with the school board. I was placed in special education classes. I hate that term, special education.
I know. I know.
Special needs.
Yes.
You know, our needs aren't special. We have the same needs as everyone else. We need
just different abilities of how to get things done.
Exactly. So, you know, we had lots of fights with the school board. I had to take an IQ test before they would let me in general education classrooms. There were busing issues because the school that I went to was actually not the school I was zoned for. One elementary school in the entire county that accepted students with disabilities, and we're all bused there. So my schedule was actually like a shorter day. So I had to leave school an hour before everybody else because of the busing schedule. And so the school system tried to use that as a justification not to let me in general ed. And so my grandparents were like, well, we'll just pick her up and drop her off. Problem solved, you know.
Yeah, like most parents would do for their child with a disability. Right. They would drop everything to, you know, do what they need to do so that you could get what you need.
Right. Well, I was at least fortunate that my grandparents were able to do that, because some parents, you know, can't. They rely on public transportation, or, you know, their work schedule won't allow for that. So fortunately, my grandparents were getting ready to retire, and my grandma worked actually at a school herself, so she could kind of finagle her schedule around to be able to accommodate that. But otherwise, they would have used that as justification to keep me in special education. And special education then, you know, it was just a general disability classroom. It didn't matter what your disability was. We were all kind of just thrown in there together, and there were dividers in the room for, you know, various grade levels, but that was really all the separation that we had. So
what do you see as the biggest barrier for people with disabilities today?
Wow. You know, we've made a lot of progress from where we were when I grew up. You know, we can't send all disabled students to one school anymore. That would be something that would be unacceptable now. But I think the issues that we run into is that the Americans with Disabilities Act was really one of the largest federal mandates, unfunded mandates.
Yes.
So we're asking businesses and private organizations, which government tries not to intrude on very much and force them to do things. We're saying, and we're telling cities, you have to spend X amount of your budget to make your city accessible. And, you know, there's that loophole that was created in the ADA. If it's not financially feasible, or it's going to be a financial burden, then you don't have to do this. And so people kind of fall back on that argument. They've used it to create loopholes. You know, we keep back and pushing the deadline back, and we've seen legislation in recent years that want to give businesses more time to make accommodations than the 30 years that they've already had. So while I don't run into some of the things that I did when I was younger, and that I know other people have experienced, where they've been literally kicked out of restaurants because, you know, I was born without arms, I ate with my feet. Been kicked out of restaurants because other patrons thought it was disgusting, and so they didn't want to see someone eating with their feet, and so the managers literally asked people to leave. So it bars those types of very blatant discrimination, but we still deal very much with covert discrimination and things that,
and ignorance as well.
Absolutely. And I think we've run into a problem that we see throughout all marginalized communities right now, and that is, how do we as a society legislate away racism and ableism and bigotry and discrimination and all of these other isms? You know, how do we legislate away attitudes? And that is a concept that this country, I think, has wrestled with since our inception. And it's that if we are going to honestly try to create an equitable society and claim that, you know, we're the land of the free in any sincere way, we're going to have to figure out how to contend with these issues and how to change attitudes and deal with not just architectural barriers. We've done a decent job of eliminating those, but there's still plenty, you know, half of downtown areas still aren't accessible or physically accessible, but there's still the societal barriers that people with disabilities face. We have not done a great job when it comes to mental health and mental illness and invisible disabilities.
So the biggest barrier is still the ideology that people have.
Right. You know,
and
and
that's
the heart of
something
any
that's
matter.
gonna take years,
Right.
beyond 30 years. It's gonna take longer, but we'll get there. I believe we'll get there. It's just,
I hope so. I hope to see it in my lifetime. You know, I think the disability community really looked at the Americans with Disabilities when this was passed, like this was this groundbreaking thing that we were mandating things to public accommodations to be accessible. But I think the disability community, you know, there was a lot of hope and optimism about the goals of the ADA and what we wanted to accomplish. But I think we still really looked at that as like, this is our first step. And I think a lot of people look at the ADA as that's the final step. You got your civil rights law and there you go and we're good. But we're not.
Is that one of the reasons why you ran for the Florida
Absolutely.
legislator? Because you believe that you could bring a voice for us individuals with disabilities?
Absolutely. You know, like there's a lot of issues that we haven't contended with. You know, we have med waiver programs in Florida with ridiculous wait lists that are decades long, with one of the largest wait lists in the country, you know, with about 25,000, it varies, that are on the intellectual and developmental disability, iBudget wait lists.
And those are the individuals that are not in crisis.
Right.
So.
And then we have, of course, the long-term care wait list, which is now 4 waivers that were rolled into one, you know, in session two years ago, where they combine the traumatic brain injury waiver with adult cystic fibrosis, with AIDS, with long-term care. And now that wait list has over 50,000 people on it. So all in all, there's, you know, over 70,000 people in Florida waiting for services. And I think society views these services not as
a necessity
or not as a right that people have to access to healthcare, to function independently, to choose where you want to live, to be as autonomous as possible, but as like a privilege, as charity. That they're doing us a favor by this. And so there's all these strings attached to these programs. So it inhibits people from working. And, you know, these are
income restrictions.
Don't grasp that this is, you know, the issues that the disability community are dealing with, but we just don't talk about them that much.
Can you share a little bit about what it was like for you to run for the Florida legislator as an individual with a disability?
Sure. You know, I've worked in politics and policy for a while. So I've worked on campaigns. I've been a field organizer. I've been a finance director. I've worn a lot of hats. So some idea of what I was getting myself into. But being a candidate is way different than being a staff member on a campaign when it's your face that's out there literally, you know, strange to see your face on buttons and, you know, car magnets and all these things that people are wearing. To see them walking around wearing your face is very strange. I don't think I ever got used to that. But I felt like I had to prove myself as a person before I could really prove myself as a candidate. And even people that I had known for years that, you know, were encouraging me to run for something, then all of a sudden when I declared and filed my paperwork, all of a sudden we're kind of hesitant and taking a step back as if they weren't sure that I could be taken seriously as a candidate, where you know, they knew I knew policy and that
What would be your advice for individuals that are seeking to run in the future or believe that they can make a difference the way you have? Because in actuality, you've paved that way. You've shown us that it is possible for a person with a disability to run.
Right. And I'm hoping that there will be more people, because I think the only way we're going to change attitudes and to have representation and to bring these conversations to the forefront in political discussions and policy discussions is to have people with disabilities actively engaged in that, running for office, to have a presence there and a kind of a constant presence. I don't want to be an example of disability exceptionalism forever. I want other people in that fight with me. And the more that we're out there doing these things, the more attention these issues that concern us and that really affect everyone on some level, and will eventually, if we live long enough, just raising awareness of these issues. But I mean, it was a tough road because a lot of your interactions on campaigns with people are through things like canvassing and phone banking. And that's really hard for people that have physical limitations when we still have neighborhoods that don't have sidewalks or busy streets.
Exactly. I was going to mention that too.
And most people's houses aren't accessible. There's steps to get to the door. So you're kind of risking your life sometimes.
Communities still haven't adopted the universal design approach.
Right.
So what was the number one issue that you were running on as far as your plan?
I focused extensively on disability rights was a huge platform issue for me, but also integrating that into other policy issues. I think people conceptualize disability rights as access to healthcare, and don't really see the other facets of life that this impacts, that every issue is a disability issue, from employment. We had the great straw debate last session that, my face was plastered everywhere and I became this like evil representation of, misuse.
I remember that. Yeah.
So I became the straw lady for that session. And that was like the only thing people wanted to talk about. So, environmental justice has to consider the needs of the disability community, or we're not going to make headway with these issues. And there's people within the disability community that care deeply about the environment, but they're not willing to sacrifice themselves for environmental performance. There's education, of course, that we care about. Still, only like 55% of Florida's public schools are architecturally accessible. And that's not talking about the fact that we don't still have funding for IDEA. So people are not receiving the services that they should be receiving from school systems. So really, I ran
especially our birth to 3 years.
Right. So I ran on a disability rights platform, but I had other issues, but I was making sure to integrate disability rights into those conversations, and not just, how it affects every other community but us, but how this affects all marginalized communities, including disability.
So you running for the Florida legislator led you to Disability Rights Florida?
Mm-hmm. I worked
what kind of work do you do there?
So I worked at a Center for Independent Living before I came to Disability Rights Florida. I was working there when I ran for office. And so I found myself calling Disability Rights Florida a lot for things that we had hit a brick wall on locally, and kind of asking for advice. And I ended up talking to my boss a lot, and we worked together on polling place accessibility during the campaign, where I went and also evaluated polling sites. So you notice that my forms were very comprehensive when I filled them out. Like I wasn't just checking yes or no, like I was explaining why certain things were a problem. And whenever I called them, like I knew the statutes and the legislation behind the questions I was asking. I was just asking, how do we contend with this when the people that are supposed to be helping with this aren't? And so he didn't know who I was exactly at the time, but I guess he looked me up and saw that I had run for office.
You figured it out
Policy,
eventually.
right? And so that led to the position at Disability Rights Florida. So I ended up in starting like the week before session for the 2019 session. And my first committee, I'd been on staff for a week, maybe two, and I ended up in committee talking about straws. Committee that my opponent was actually the chair of.
Wow.
So we made it onto like the front page of the Sarasota Herald Tribune, because that's the area that I ran in, and how, you know, we were opponents and now we were working together on this issue. And, you know, so, I mean, that really kind of triggered, I think, a lot of the attention for the straw debate. Was kind of the name that I had built for myself running for office. And it did get a lot more media attention than I think some other campaigns would, just because of the novelty of, oh my gosh, we have this person running for office with a disability. And if I would have won that race, I would have been the first woman with a visible disability ever elected to the legislature. And there's, you know, I hit my head on that glass ceiling, but that's okay. It was a tough, you know, I did my best. Of course, I wanted to win, but when I lost, I wasn't like overly surprised. Actually, we were laughing on election night at the watch party because turnout was so high that I actually hit my win number. So everyone has a win number of the number of votes you need to win the election.
Have you thought about running again?
I get that question a lot. Probably eventually. I'm sitting 2020 out, but I may consider something in 22, 24.
Because of what's going on right now. And
I relocated too. So I'm up in Tallahassee now. And so I want to build inroads in a community before I try to represent it in any capacity. I don't want to move into a city and say, I know all about you, and, you know, not have established those relationships. And
so every county is different throughout Florida.
Right.
So
absolutely.
Well, that's interesting. And I enjoy hearing about your experiences and your insight to different topics. I wanted to pick your brain about employment. What are your thoughts on that for people with disabilities?
I think that there are a lot of obstacles with that. You know, the Americans with Disabilities Act, of course, established that you can't discriminate on the basis for disability, but we didn't put the onus on the employer. We put the onus on the applicant to prove that discrimination took place, instead of requiring the employer to establish that discrimination did not take place. And so I think that puts people with disabilities in a difficult situation, because it's very hard to prove when you don't have access to other people's applications and their resumes and their interview notes to prove that, yes, I was the best fit, I was the best candidate for that. So they can deny you a job, even if you suspect it may have been based on disability discrimination. Proving that is a whole nother matter and very difficult to do. So I think that is one obstacle that's created, but also, as we mentioned before, you know, a lot of the programs that people with disabilities depend on have income restrictions. And so they can't earn above X amount.
Yeah.
And if you earn $1 above that, you lose all your services.
You lose your health care, for example. And that's why a lot of people have this misconception of people with disabilities not wanting to work, when we actually do. But it's these laws that were made in previous decades and years that have not been updated on a federal level, and then it goes down all the way down to the state. So people, when they make, like, let's say in the state of Florida, like $34,000 or $36,000, if they make $1 more, they lose their health care. So they're stuck.
And how are you going to $34,000 a year, pay your bills, keep your lights on, feed yourself, and also pay for
medical expenses
and, you know, a lot of these services that are paid for by these programs, when they cost more than what you bring home in your salary. So, you know, that of course is very limiting for a lot of people with disabilities. And we found in states that have actually done Medicaid expansion, so they've uncoupled Medicaid and Social Security, that a lot of people with disabilities don't apply for Social Security. They just apply for Medicaid. They don't care about the cash benefit. They don't want that.
Exactly.
They care
And
about just the health care.
That's what I say to Social Security too. I'd rather just have my health care and work and buy into my Medicaid versus just receiving a check and not contributing to society. So,
but I hope that the fact that, you know, I mean, this was kind of an assertion that the disability community was making, that yes, we want to work, we just need access to healthcare, but we didn't really have the data before to back that up. But now that we've seen states expand Medicaid and seen the results of that and seen how the disability community has reacted and how employment rates have gone up in some of those states and the number of people that have just applied for Medicaid, now we have data to back that up to kind of push for more changes. And I'm hopeful.
Do you think Florida would ever head in that direction with Medicaid expansion?
That's a tough question. When we almost got there in 2014, we were so close, and then we had the Medicaid walkout that, you know, it killed that bill along with all the other bills that were sitting on the floor at the time. But, you know, we almost got there at that point. I don't know that we have the right environment right now to try to pursue that. There's been some bills in session for the past couple of years that would expand Medicaid, and we just haven't moved them.
So what can individuals like me and other advocates and other self-advocates and families do to educate our legislators? How can we do that?
And, you know, definitely reaching out to them, building those relationships. It's important. A lot of people, just, I'm not talking about disability, but I mean just people in general, don't know who their state representative is, or who their state senator is, or who their city council members are. So I think establishing those relationships, and even just an introduction of, hi, my name is, and these are the issues that I'm contending with. And I think putting a face to those issues is important, that they see that, you know, this isn't some hypothetical hyperbole that we're pushing out, that these are real people that live in their districts that are faced with this. And I think putting pressure that way and getting others to, you know, sign on to letters of support or to meet with them, especially with people with disabilities, and not just organizations that claim to represent people with disabilities, actual disabled people having
through not just words, but through actions.
Right.
So that leads into my next question, and my last question is, how can communities and other organizations promote inclusion and foster inclusion, not just by their words, but through action? How can they do that? How can they create that inclusive environment?
I mean, we need to make sure that we have seats at the table for the disability community, particularly in policy discussions that affect people with disabilities. People with disabilities need to be represented at those tables. So, you know, at the local level, a lot of cities and areas have formed citizens with disabilities advisory boards for city and county commissions, and they've managed to accomplish a lot. I actually served on the Citizens with Disabilities Advisory Board in Sarasota, and when they changed their parking garages from free to paid, one of the issues that raised is, hey, not everybody can reach out the car window and grab that ticket. I'm one of those people. So we made sure that there was a system that kind of worked like SunPass, where you have a tag or a sticker on your windshield that you can purchase, and then you know, it deducts money from that. So kind of the solution that we've developed, and our Citizens with Disabilities Advisory Board actually had a pretty decent budget. We actually were funded by tickets for people parking illegally in disabled parking spaces in the committee.
Interesting.
So we paid for that. We agreed as a board to dedicate our funds to accessing the equipment to make the parking garages more accessible to drivers with disabilities. Because of conversations that we had All of the cities and counties were talking about straw bans. Sarasota did not implement one to the same extent that other cities did. They provided an exception, not just for people with disabilities, because we can't force people with disabilities to disclose their disability. And somebody may need a straw and you can't tell that by looking at them. So they just did an exception that straws had to be made available upon request. And that was because of the actions of the Citizens with Disabilities Advisory Board. So I think having disabled people engaged in policy discussions and getting to voice opinions and perspectives on policies and ordinances before they're implemented can really help guide cities into the things that they want to do. Doing, complete street assessments to make sure that there are curb cuts everywhere that they need to be, and, running these things by the disability community that, if you build your sidewalks completely out of paving stones and bricks, that's not great for people that can trip or that are in chairs and, we're rattling our teeth out of our head going down the sidewalk.
People don't realize what they take for granted, everyday people.
Right. But I think having those advisory boards absolutely has been essential to advancing accessibility at the local level. And I would like to see us form something like that.
On the state level.
Every governor has had a commission on disability, starting with Charlie Crist. So Rick Scott had one. Governor DeSantis has not established one as of yet.
But he still has some time. So
we'd like to see something with the governor's office, with a commission on disability. And we need to make sure that we're including disability in our discussions of diversity. You can't call yourself diverse if you're excluding the largest marginalized community in the United States.
And a lot of people don't know that.
Right.
That we're the largest marginalized and minority group. Disability affects everyone, and it's cross-sectional. It doesn't matter what background or cultural or race you are. In every group, there is a disability somewhere. So,
and so of course we need to be mindful of racial diversity and gender diversity, but we need to make sure that we're including disabled voices in there too, because especially when you have people that exist at the intersection of those communities, that only exacerbates the problems that they deal with as a person with a disability or as a person that is a racial or religious minority. It amplifies those problems for those individuals. We need to make sure that they have a voice in this conversation as well.
Well, I appreciate you taking the time today to interview with me, and I can't wait to hear more about your presentation on July 31st. So everyone join us on Facebook Live from 9 a.m. to 2 p.m. And you could see Olivia's presentation on employment. Is that correct?
Yep.
And disability rights. So I want to thank Disability Rights Florida as well for allowing us to have you come and present for this event. So,
absolutely. We're excited as an organization to be participating.
So thank you so much for all that you do within your community and your experience and sharing and giving us advice and what your thoughts on these important issues that affect so many individuals throughout not just our state, but our country as well. So thank you.
Absolutely. And thank you for all you're doing with coordinating the events and your efforts as well.
Trying. It's one day at a time, one voice at a time. And
absolutely.
This is an opportunity for all advocates to come together as one united front. So
absolutely.
That's important.
Okay. Well, thank you.
Thank you.